Hello, hello.
Hello.
Hi. I see y'all are connected to audio. Hi, go ahead and drop in the
Hello.
chat your name, where you're from. Hi, Alex. So good to see you. We still have a few folks coming in from the breakout room, so we'll give them a few seconds to get connected to audio. I see the numbers still going up in participants. The chat is blowing up, so many different geographies. Welcome, Hawaii. We got Pasadena, Chicago, New Jersey, Massachusetts, Hawaii again, San Diego, Illinois, we see you, New York, we'll be seeing you soon. All right, the numbers are still going up in participants. People are still coming in. Welcome, welcome. Portland, Oregon, Jacksonville, Florida, Dayton, Ohio. Wonderful. All right, well, as others are joining us, I'd like to welcome everyone. This is the first installment of our Data for Action Summit series. My name is Michaela Trujillo. I am a certified community health worker and certified peer support worker, a person with lived experience, and a returning citizen. I am the capacity building coordinator, and I am beyond grateful to support 12 incredible CHW leaders and experts from across the United States, serving in diverse roles, sectors, genders, cultural care, titles, geography, and specialties of community health. I am also proudly joined by my NACHW teammates, Denise Octavia Smith, Executive Director, Allison Joslin, Data and Evaluations Manager, and along with Aurora Grant Wingate, Member and Partner Engagement Associate. I want to give a special round of applause to all of you here with us today. This is my silent round of applause. We understand that your time on this webinar is precious, and we will be providing a certificate of attendance that NACHW respectfully requests to be honored as continuing education credits that can be used towards certification in your state per their requirements for everyone on the call. As we move through this presentation, please drop your questions in the chat. We love and encourage audience engagement. We will be taking the time to review this information and producing a frequently asked question sheet to go along with the full national report coming soon. We are excited to share it with you all and invite you to spread the full report far and wide just as soon as it becomes available on the NACHW website. In today's session, we will be unpacking our first set of data, which includes diversity of CHWs by geography, ethnicity, race, cultures, CHW professional roles and titles, career gateways, requirements, pathways, and advancement barriers, and a community circle breakout session. This is a 4-part series, so please make sure to mark your calendars for September 29th, October 13th, and for our grand finale session on October 27th, same time, same Zoom link. At the end of each session, we will gather in smaller community circles in breakout sessions. These rooms are a safe space where your voice is encouraged and uplifted. In the rooms, you will be joined by our awesome leaders and staff to explore on the Jamboard how this data can work for you in your community through dignity and respect, empowerment, social justice and equity, unity, integrity, and self-determination. Small disclosure, this online seminar is being recorded for future educational purposes. Join me in a short history lesson on the National Association of Community Health Workers. We are a young organization with 3 years in operation. NACHW has strong and diverse individuals that sit on its board of directors, whose primary job is to put our shareholders' needs before their own and uphold the integrity and values of the organization. In addition to that, NACHW has 10 incredible staff members across geography who are committed to growth and evolution and lead our day-to-day operations. NACHW prides itself on strategically developing and advancing the CHW profession. We are a values-based organization, meaning we bring our morals to the forefront of everything we do. And these include being a national voice for CHWs under all umbrella terms, enhancing policy, advancing the workforce, and driving CHW leadership while building capacity. We proudly hold membership representation in all 50 states with over 2,000 members total. I welcome you to the Advanced CHW project, which is proudly funded by Johnson & Johnson and whose mission is to combat racial inequities and health disparities for people of color. Over the last 2 years of this program, Johnson & Johnson leaders have worked tirelessly to develop a national survey that explores and builds recognition of the CHW professional identity. Community health workers' integration within medical, public health, and social initiatives is essential to eradicate social injustice and health inequities experienced by minorities. This data should be used for action to reverse harmful practices and barriers to CHW's self-determination, leadership advancement, and sustainability. Before we start on our journey into data learning, I would like to pass the mic over to Allison Joslin to share the survey history and methodology used in analyzing this data.
Thanks, Michaela. We share this next slide to highlight key learnings from exploring the data, as well as how we processed or cleaned the data to ensure data quality. In many of the questions, we ask for CHWs to reflect on experiences during the year amidst the COVID-19 pandemic and civil unrest. This enormous undertaking in building a state-of-the-art 51-question survey by CHWs for CHWs during this unprecedented time was organized by NACHW with CHW leaders and other stakeholders at the helm. On the left side of the screen, the data team identified missing responses, explored neutral response meanings, removed duplication of entries, and noted any unique characteristics during the data cleaning process. For example, 28% of CHW respondents were from North Carolina because of a single employer distributed the survey to their team. We also disaggregated all 51 questions by race and ethnicity, and again, disaggregated the data by national regions. So what does disaggregating data mean? Disaggregating data means breaking information into smaller pieces to showcase trends and patterns that may not be visible at a whole population. Why would we want to disaggregate this data and information of CHWs? It is critical to be able to monitor and describe critical racial disparities and health inequities by location across where we live, pray, play, get educated, and get our healthcare. This allows for further examination from a baseline of data to dismantle structural inequities, monitor, and further prioritize CHW values. Where we see observable and unique differences, as well as where we are united in responses, we report them in this presentation and in the upcoming release of the report. On the right side of the screen, we want to express that 867 CHWs from 859 different zip codes responded to the survey between the months of June and September 2021. 772 CHWs responded in the English version and 95 CHWs responded in the Spanish version, with 27 different languages spoken as well. We know that CHW is an umbrella term, and therefore we found that 93 different titles were also represented among respondents, further solidifying the strength and power of this data. Thank you again for reviewing the methodology. I'll hand the mic back to Michaela for her introduction of our profound CHW leaders.
That is such great insight and background. Thank you, Allison. It is my honor to introduce these first two ladies who will be leading us in the Spanish community circle with you all today. Ms. Maria Ortiz is the Executive Director of Familias Triunfadoras Incorporated, serving El Paso, Texas. And Ms. Rosa Perez faithfully works to provide chronic care and COVID-19 resources at El Sol Neighborhood Educational Center in San Bernardino, California. Give them a hand. Now, I introduce your amazing facilitators for today. Ms. Andrea Krotzer is a veteran CHW trainer at Everyday Life CHW, joining us from Michigan. And Ms. Diane Jones is a violence intervention specialist and spiritual advisor, who is a guiding light in the Hartford, Connecticut area. Take it away, Ms. Diane.
Miss Diane, I think you might be muted.
Uh-oh.
Yes, can you hear me now? I'm going to start over, okay, everyone? Thank you. Well, thank you, Michaela, again. Let's start all over. We are taking you along on a journey of community health work. We hope that you listen to the expression of the needs of CHWs just like you and me. Please take a moment and envision the faces of this data, beginning with the diversity of community health workers by geography, ethnicity, race, and culture. Together, we will be learning who responded to the survey and where they came from, as well will we walk through the social features of the CHW workforce. Follow me to the map on the left. We see that the states highlighted with darker shade of purple mean there's a higher number of CHW representations, whereas the lighter shades mean there's a smaller percentage of CHW representatives who completed the survey. We would like to hear from you. Write in the chat what state you are from, and does the map show a lighter or darker shade of purple for your state? Okay. Now, move your eyes to the right of the slide, to the colorful globe. It shows us the percentage of CHWs completing the survey in each region of the United States. We see that each region of the US has an even distribution of CHW survey respondents. There were 3 times more survey takers from North Carolina, which increases the percentage in the South Atlantic region. Next, we can picture how extremely diverse our workforce is, including 7 primary racial identities, over 28% of multiracial participants, and 37.7% were of Hispanic, Latino origin. We gave survey respondents the opportunity to write in and self-identify race, ethnicity, and culture. And 11% of CHWs reported multiracial identities. We can further see the faces of our workforce in the graphics on the left. It is a heavily driven female staff showing us that 88.6% are female. Only 11% are male. You may have heard manpower, but we are the woman's power. We can listen and hear our voices through the icon to the right, showing us the languages that we provide services, which are Spanish, Haitian Creole, and even more other native dialects and languages. Now here, we can see our ages, with an equal majority appearing in all age categories, but slightly the highest in percentage is our 45 through 54 age range, followed closely by 55 through 64-year-olds. And we can also understand the education levels we have completed by looking at the graduation gap to the right. It shows that most of us have some college or two-year degree. Now let's turn our attention over to our Executive Director, Denise, to challenge us in opportunities for action.
Oh, thank you, Miss Diane. It's such an honor to share this space with you, and welcome everyone. Hearing from Miss Diane is opening our eyes to who we are as a national profession. We all resemble one another, and through our demographics, we are starting to envision the location, the gender identities, the native languages spoken, the cultures, the beauty, and the origin of the people behind these statistics. So now this is my favorite piece of our presentation, what we know as opportunities for action. And each of us in this room holds the power to steer our profession in the direction of unity and sustainability that will carry us far into the future, moving as one, allied and entrusted in and into one another. Our commitment is to strengthen our CHWs from the federal and local sectors, workforce, research, and as individuals. As you're looking at the slide, I just want to highlight that we advocate for the recruitment and hiring of authentic CHWs. We are asking you to remove the barriers to recruitment, training, and certification and employment. They are myriad, and they include educational requirements, past criminal record, and English proficiency. We want you to permanently fund CHW's roles, including our roles in the social determinants of health, and invest in our career advancement pathways like certification and continuing education, tuition reimbursement, pay raises, etc. So now our next leader, Andrea, will continue to guide us through our journey.
Well said, Denise. As we move through our journey of community health work, we now come to a place where we have described how long we have identified as a CHW, what we do, whom we serve, our recent work, and whom we partner with. Increasingly, we see on the clock that 67% of our survey participants say they have entered the workforce within the last 5 years. And our veteran workforce of 25 plus years of service is only over the 3% mark. On this slide, we understand that there are many titles that encompass community health work. Our top 3 descriptions of this title that respondents selected are: first place is the community health representative. Second place is outreach specialist or worker. And coming in third place is a community health educator. Now, this wheel we see here is as diverse and unique as we all are. The rainbow colors on the wheel express that we are widely inclusive and embrace all 97 professional titles. Yes, that's 97 professional titles that reflect the work of community health and wellness. Please let us know in the chat what you identify as. This is a safe space for you to communicate with us. These are more than just titles. These are real people serving our communities. The top 4 populations served within the survey included liaisons to rural residents, non-English speakers, individuals with complex healthcare needs, and the highest serving population is individuals without insurance. In this snapshot, we follow how CHWs described their practice during the toughest times of the COVID-19 pandemic. Our primary role was to provide health education and prevention information. Then we were providing outreach, care coordination, case management, and system navigation, as well as advocacy and coaching and social support. We are the bridge and the interpreter of health messages. As we can visualize these types of roles, CHWs are really the local heroes throughout the pandemic. As we reflect on the height of the COVID-19 pandemic, we see that our collaboration was strengthened as we partnered with the following organizations and sectors to help our community overcome the social determinants of health. Community-based organizations, also nonprofits, food insecurity areas, including pantries, soup kitchens, home delivery, county, state, tribal health departments, hospital and health systems, and housing, including shelters and transitional homes. These were all critical components of meeting our community's basic living needs during such a trying time. Now let's hear from Denise Smith for more action.
Thank you so much, Andrea. After witnessing the true resiliency and determination of our workforce in this last section of data, I want to challenge you to stand as advocates in the following opportunities. We invite you to, indeed, we must compensate CHWs for their years of service and expertise. Center our lived experience. Partner with CHWs. Partner with us to improve cross-sector care. We want to retain our title of CHW in our employment promotions and more. Integrate our leadership in the design of programs and policies, and protect CHW achievements and advancements through ethical practices in the workplace, research, and beyond. Being on this journey with all of you inspires and motivates me. I'm moved by all the ways community healing shines through so brilliantly in this data. So let's continue. Ms. Diane, the floor is yours.
Yes, so true. I'd like to walk you through how we got here. Career gateways, requirements, and advancement barriers. Here, we see trends around training, career start, pathways, values, certification, continuing education, role evaluation, barriers, and demand for more education. This bar graph shows that we are all students as well as teachers by having completed training in a variety of competencies. The most common were communication, interpersonal and relationship building, racial and health equity, culturally appropriate health education and information, outreach, and community engagement. However, less than 15% of CHWs do not yet have training in grant writing, budgeting, finance, or policy development, which are crucial for sustaining the CHW role. Many of these areas of training can be found in the C3 core competencies. Thinking back on how we started our CHW role, we discovered that many of us began our CHW role through employer training and nonprofit organizations. More than 21% of CHWs credit lived experience, state certification, and volunteering in the community. On the future, we believe that salary increases, retention of CHW title with advancement, and new program project development should be included in career advancement. And there were over 10 additional options that we selected. Let us know in the chat if you agree or feel something is missing. Within our responses, we all stand united on choosing the top 3 career path options. I mentioned before, being interestingly, Latin American CHWs also voiced the importance of the authority to lead project teams. Throughout the United States, we have had experiences with employers that require continuing education for employment with 26%. And 35% of CHWs say that continuing education is not required for their employment. Also, continuing education is free for 20% of us and is not free for 17% of us. Overall, 23% of CHWs were unsure or did not select any of the options for this question. Some of the most popular continuing education topics include motivational interviewing, health education, creating a health action plan, 5 stages of behavior change, and health coaching skills. We also look at continuing education compared by region. And we see noticeably inequalities in all regions when we are in considering requirements and costs. Continuing education is a fundamental instrument in polishing our skills and staying sharp in our awareness of community needs. Andrea, can you tell us what is recorded about CHW certification in the survey? Take it away.
Sure, Diane. CHWs are sometimes endorsed by states and other organizations for their competence in formal CHW training. Throughout our geography, we see inconsistency in certification. 27% of CHWs report that certification is required for employment, while 41% of CHWs report that certification is optional for employment. And 11% report that CHW certification is not available in the state where CHWs live. Are you familiar with what is required for CHW certification in your state? If there's no certification in your state or you are unsure, please let us know in the chat. We are here to learn from each other. That is the way we can make the real impact. Now, we CHWs pride ourselves on never-ending education. We are students at heart and remain teachable throughout our careers. We feel that our continuing education should be valued at the highest level, next to on-the-job experience, as well as completing CHW certification. These top three factors reflect our self-determination. As we may need to meet the following requirements through our employers in various sectors, including a high school diploma, no criminal record, owning a vehicle, fluency in English, and fluency in a second language, which at times causes barriers to success of CHW advancement, and utilizing lived experience that effectively addresses the social determinants of health in our own communities. We know evaluations are used to assess our knowledge on many levels and areas within our role, including, but not limited to, interpersonal skills, case management, client rapport, and more. We have learned that most CHWs may be evaluated in any of the following ways: an annual review, a monthly review. Evaluations may also include continuing education sessions. And in sometimes cases, CHWs rely on community feedback to summarize the trust, milestones, and outcomes of services between us and a client or patient. And 12% of us reported that they received no monitoring or evaluation. This could be another barrier for us. CHWs whose goal is to climb the career ladder or advancement ladder, but are not receiving the basic documentation to support our career growth. We then asked which trainings should be made available to all CHWs. The top 3 that appeared are number 1 being social determinants of health. Number 2, health and racial equity. And number 3 is health disparities. But ultimately, we felt that all 8 training options listed should be made available to all CHWs. When we responded to questions about barriers to CHW success, we see that the highest recorded barrier is funding for our roles, followed by certification barriers, and very closely followed by higher level education. And finally, other credentials. Do you relate to any of these? Has anyone experienced similar barriers? Please put your responses in the chat. We'd like to hear from you because your voice matters. And please remember that this is a safe space. And then compared these barriers across to our race and ethnicity, and we understand that funding for our role is the highest barrier to success, along with certification. However, I'd like us to pay special attention to the inequality that some of us are experiencing by having even more barriers to becoming successful due to the certification than others. Specifically, Pacific Islanders, CHWs, have reported a noticeably higher barrier than that of Asian or South Asian CHW communities. Over to you, Denise.
Thank you again, Andrea and Ms. Diane, for painting these very vivid pictures of events and experiences that our peers and our people are experiencing right now. I again bring to your attention, there are things we can do right now to alleviate these inequities in our own workforce, and they're right here on your screen. We know CHWs want training in the social determinants of health, grant writing, budgeting, and finance to prepare for career advancement. We heard you, CHWs, when you said you need funders, payers, and policymakers to recognize that in most states, certification is optional for employment, and to eliminate language barriers and other requirements. We encourage employers to collaborate with CHWs on the design and implementation of their employment reviews. We promote CHW research that solidifies certification and funding for CHW roles as barriers to CHW self-determination, advancement, and sustainability. We are advocating for CHW payers and funders to eliminate short-term grants and restricted reimbursement for CHW roles. We are openly and widely sharing CHW workforce data that has been disaggregated to capture the voices of marginalized communities and diverse races, ethnicities, languages, and genders. These opportunities for action are all our duty and responsibility to the workforce to improve upon for future generations of CHWs to come. We are the trusted messengers to our most vulnerable community members, our neighbors, our families, and our people. We've been called upon by decision makers and various other sectors to provide solutions and safety to those in need of it the most, and together we can leverage this need to its highest value. We, CHWs, are an asset to the workforce, and we can all take part in unifying and solidifying this profession that chose us. Just by adding this national survey data to your everyday service toolkit and advocating for the history of community health work, as well as securing our place in the national workforce discussion for the future. It has been my pleasure to be in the virtual space with each of you, my sisters, my brothers, my elders, my teachers, my mentors. And today, right now, I'm going to turn the mic back to Michaela Trujillo. So proud to share this space with you, and thank you for your deep compassion and service. Michaela will take it over for questions, and she'll lead us in our community circle breakout.
Thank you, Denise, for that powerful call to action. Before we head into our community circles, we can take a few questions about the survey. Feel free to come off mute, put them in the chat, and we will answer your questions as best we can. Don't forget that our questions will be reviewed and added to our upcoming frequently asked questions section of our national survey webpage at www.nachw.org. I see some stuff in the chat coming in already. I love this. Kimberly, the history of CHWs needs to be mandatory training for all of us so that we are better equipped to stand and advocate. Sorry, I lost it. Politically. Absolutely. Do you think personality tests will help figure out our strengths and weaknesses, how we can work individually and in a team? I do believe there is a lot of incorrectness in this profession, like the Umbato phrase, I am because you are. Absolutely, I think personality tests and team tests are super important. It just gives you a better feel of who you're working with. And we at NACHW like to use the phrase, nothing about us without us. So there's a little remake to that one. Are there any plans for follow-up surveys? Kathy, yes, we have definitely had this discussion internally, and we are hoping to keep this survey current in the coming years. So we will be using the questions that you share with us here today as a starting point for the next coming surveys. So if there's something specific that you didn't see, it may be covered in the later topics. And if it's not, we can definitely include it in our future 2024 CHW survey. Can you explain the desire for retention of CHW title with the advancement? Is reflecting a desire to ensure that the CHW identity doesn't get lost and remains valued? Oh, Kiara, would you like me to blow minds today? Okay. So through our learning collaboratives, we have an overall consensus that CHWs would like to climb and advance the ladder in their careers, but they are true to their CHW title. They don't want to shift into other areas of the profession, including social work, public health, or things like that. Oftentimes what we have recognized as advancing in the CHW title is accreditations under CHW 1, 2, or 3. But we envision a future much brighter than that is based and recognized and compensated by your educational training and specialties, years of experience, and leadership abilities. So I hope that answered your question, Kiara. Let's see, following, there's some chat is going crazy. All right, Luis says defining the scope of work for CHWs, I think, is important. We find ourselves challenged sometimes thinking that we are all social workers. I completely agree. And I also would like to add in that each scope of work for CHWs should be designed around the needs of the community, the requirements, and the day-to-day tasks. One role does not fit all. Do you know if there's a place where they have grant writing for CHWs in New Jersey? We can definitely table that question. I do have CHW leaders on the call present with you today. If Nikki, if you're able to maybe offer some insight into the chat for, I'm sorry, I lost the name.
I think it's Quadira.
Quadira, yes, if you could help answer that. If not, we'll table that and we'll get some research together and see what we can find for you. And Aurora's shared the next 3 webinar topics in the link. You're welcome. And thank you, Victoria. We look forward to seeing you in the next couple webinars as well. Let's see, Laura says, as a CHW, I am not as limited in services I provide as a social worker at GJFSR. I see. Yeah, chat going crazy, Kimberly. We're going up in this session today. Let's see, Leslie says, can there be a group of universities that can offer MAs in public health for CHWs who are interested? Yeah, I think that that would be a possibility. It's definitely up to the governance of each university in your community. Denise, did you want to add something to that?
Yeah, thanks so much for the question. I think, was it Leslie who lifted that up? I think a couple of things. One, we have a number of folks on this call who are in community, who are training CHWs, who are what I call CHW OGs. They've been doing this for decades, like Ms. Diane, like Andrea, right, like others on the call. And NACHW promotes the APHA policy that whenever workforce development decisions are being made, right, when you have a decision-making body, that it is comprised of at least 50% or more of community health workers. So I think the question of whether CHWs want to advance through the traditional public health pathway is certainly their choice, and they should be able to retain their title as CHW. And then if they want to add on the letters of MPH, I think that's good. But what's really critical is that we have CHWs developing the curriculum, right? We have CHWs who are leading the idea of what are the learning objectives, right? What is the purpose of the CHW in public health? And the last thing I'll just say is that the COVID-19 pandemic has shown us that we cannot assume that all CHW organizations, alliances, networks, associations, and individual promotores, aunties, peers, CHWs are actually connected to our public health infrastructure. So we've got some work to do, I think, for public health to understand, to authentically partner with us. And I look forward to what you'll build in your state, in your region, right, in authentic partnership.
Thank you, Denise. Your voice and your power is just always so moving, and it inspires us to take action. Let's see. Oh, awesome, thanks. How will NACHW and the guys are going faster than I am, the CHW community use this data to advocate for the suggested courses of action amongst employment, public health, and governmental sectors? Denise, I think you can get into the weeds of that and the depth of what that will take.
Yeah, and I know that we're short on time, so let me just say I may not give a full answer. You know, we started in February 2021 with our national policy platform. Some of the work of building this national data with Michaela, I know Gary, Andrea, Diane, Nikki, Danina, there are others on the call, Maria, Rosa, CHWs from across the country who built this data set. We did so because we felt like these questions that were critical to our self-determination, to our leadership definition, and our advancement were not being asked in other national surveys. Right? So this was an opportunity to position our voices in research development, but also to clarify what are we prioritizing, when we talk about developing CHW policy and sustainability. It is not just reimbursement. It's not just Medicaid codes, right? It's not just integrating us underneath other clinical or behavioral health providers, right? It is advancing the leadership, the voice, the perspective, the priority from the community. So right now, NACHW has already started the advocacy. We're building a movement by sharing this data, by creating awareness for you at the national level, and then also looking at the state level, looking by language, looking by region, okay, looking by culture, by race, ethnicity, so that you can begin to say, are we collecting this data in our state? When we're training CHWs, when we're building state policy, are we taking some of these aspects into account? When the dollars come into your state to build the public health infrastructure, are CHW leaders at the table? Our associations, our networks, our coalitions, our alliances. Do you have CHW leadership in the design and the development of your academic research on interventions that work in community, right? Are your trainings culturally and linguistically appropriate? Are you creating barriers to career advancement? So we're advocating right now, in my mind, because what we're doing is we're challenging all of us to take wherever we are at the state or national level, wherever your sphere of influence is, and go deeper. If you are a leader and you're an ally and you're working on a CHW policy, do you have CHW co-leadership? Are you cultivating CHW leadership? So what we're doing is we're taking this data on the road. We're sharing this data at the American Public Health Conference. We're super excited to be invited to do that. I believe we're going to do it at the National Business Meeting. We highlighted this data at the Unity Conference, and over the next year, some of the NACHW team is going to be joining me to come around the country to do what we call taking data and moving it to action. So the last thing I'll say is the CHW leaders that you see here and many more who are on the webinar today, we also have been trained to do policy analysis and power analysis. So we're going to use this data at the national level, at the regional level, at the state level to begin to organize, right, and build capacity of CHWs to write policy, right? So that CHW voices at the local level can knock on the doors of their representatives, their senators, their governors, right? Their hospital CEOs, their state, philanthropic organizations, right? And you can bring this data and say, NACHW has shown us that this is what's going on. What do you think about this? How can we build awareness and responsibility of tax dollars and of social justice to center CHW voices? So invite us to your conference is what I would say. If you're having a summit and you want leaders like Ms. Diane, Andrea, Michaela, and myself to come out and to work with you to build momentum, to support what you're already doing, right? We want to big you up and amplify your expertise. And we hope that this data will support you in doing that. Boy, what a long answer.
But an important answer. We love it. Yes, please invite us to your conferences, to any areas in your local community that you feel that this data can provide action, where policy and decision makers need to will listen, and we have the opportunity to share. I see some of those invitations coming in the chat already, so I just want to say thank you for inviting us into your local community and your safe space. And we promise that we will honor in all the work that we do. All right, is there any final questions before we go into our wonderful community circles? I don't want anybody's question to feel like they did not get answered. I'd love to go to a CHW graduation.
Yes, we see those invites. Thank you so much. We were excited to do that. We will save the chat. We'll do our best to follow up. It may take us a little time, but thank you so much for your kindness.
All right, now we have come to my favorite part of the CHW data journey, our community circle breakout rooms. There are multiple ways to participate in your circle, including our open discussion with our CHW leaders and staff, the chat function, and the Jamboard link directly, whatever you feel comfortable with. The first question to explore in your community circle is, what story do you have to share about your lived experience that connects with some of the data that you saw here today? If you like us to share your answers to any of the 3 questions on the social media or on our website, all you have to do is add your city and state. No names, please. Our second question is, what data points are crucial to CHW needs in your community? And our final question is, what are the urgent policy issues where you are that you think this data can be pushed and applied? How can NACHW help with that? Again, if you'd like any of your answers shared on our social media or website to increase advocacy, all we need is your city and state. I'm going to let Aurora take us into our breakout rooms. We will offer a Spanish breakout room for those of you who would like that. We will also have our CHW leaders and staff facilitating and journaling the conversation in these rooms. So I hope that you feel safe. I hope you feel connected, and let's get some of this data into action. Fresno, California. Okay, so great. I see some people dropping in their city and state already. When we move into our breakout rooms, just tell your facilitator that you're comfortable with this information being shared, and we'll get it on the Jamboard, in the chat, or documented in some way. We're just gonna give Aurora a few minutes here. I've got people from all over. Look, New Mexico is in the house, Dallas, Texas, Chicago, Illinois, Raleigh, North Carolina, Columbus, Ohio, Springfield, Ohio, Rochester, Massachusetts, Louisville, Kentucky, Indianapolis. Okay, I'm going too fast. I'm not an auction speaker. All right, let's move into our breakout rooms. See you guys soon. Have fun.
I was having issues with my internet. I was just wondering if you can help me.
Yes. Diana? Wait, I'm sorry. I didn't see the.
Yeah, this is Diana, lady.
Hi, Diana. Let me help you out here.
I don't even see the breakout rooms on the list, so.
I don't either.
Sure.
Yeah, okay. I'm glad
Sure.
somebody said something because I'm like,
Yeah,
I don't see
the
them
big
either.
Thank you, guys. Let me help you out. So there are 3 dots at the bottom of your screen. You can click those options. It'll take you into breakout rooms, and you can choose a name of a facilitator to join. If you are on a phone, you may want to scroll all the way to the right, I believe it is, and it will also give you the 3 options.
I don't have the 3 dots.
I don't have it either.
Yeah.
Neither do I.
I don't either.
I have the 3 dots, but it doesn't have the breakout room options that I'm used to.
Yeah, and I've been able to I've been able to do it on my phone before.
Oh,
so I know
shoot.
that it exists, but I don't
Yeah,
see it.
I have the 3 dots, but no breakout room.
All right, no worries. I'm going to help you guys out here. Thank you.
Thank you.
If you end up in a Spanish breakout room, or if you're not in a Spanish breakout room and you would like to be, please just hit the help or call, and I think it's call host back. We'll help you out, Philip. Thank you guys for your patience. This is our first run of show.
All right.
We appreciate your help.
Yep.
I think we all kind of needed the 2-minute downtime just to breathe. Oh, here we
Yeah,
go.
absolutely. We sure did give you a buffet of data in a very short amount of time. So I'm glad you guys were able to take that space to digest.
Yeah, they just updated my Zoom thing, but there's nothing, the breakout rooms aren't here at all.
Same.
Huh, all right.
Same here.
Same here. I don't know why. I don't know what's happening. I have issues all day, but I'm not sure.
Yeah.
Well, how long is the breakout session? Maybe
It'll be 30 minutes and I'm going to, it should pop up that says the host is asking you to join breakout room.
yeah, that's
So
what
far,
I've
no.
had in the past.
There you go. There you go. I got it.
Oh, wonderful.
I didn't see, I
I don't have it.
Yeah, we're
Yeah,
working-
I don't have it either.
it'll come up on your screen. Just give us a few seconds.
Oh, okay, cool.
All right, we are chipping away at these participants left here in the main room. We got about 87 to move into breakout rooms. So Shirley, don't laugh at me.
Kayla, do you want any help with the signing, or
Please,
I don't want to
Peter.
mess I don't want to mess you up by like.
Yeah, please go for it. I'll take my hands off.
They put me back here.
Uh-oh.
Mine
All right.
kicked me out and then brought me back onto the meeting.
1 minute, I see the 3 dots, join breakout room.
It's, yeah, Zoom's gonna make us dizzy for our community circles today. I'm asking for tech help from our communications team member, Peter. So we'll just give him a few minutes to work his magic and we appreciate your patience.
No problem.
All right, Sarah, Sarah, I see that you need that one. I don't want to manually assign right now because I don't want to mess up Peter, who's going to be helping with our breakout room session settings. I'm sorry. But good thing we did this with a few minutes earlier, so we have our full 30 minutes to gather in community with each other and discuss the 3 questions. So we have some cushion time. Thank you, Lindsay. All right, people are moving, people are moving. Woohoo.
Hi, excuse me, can you please to move to the Spanish group? Oh,
Yes, I gotcha.
okay, thank you.
We have asked you to join. Okay, perfect. Let's see. So it looks like our breakout rooms are assigned. Please check your computer screen to see if you are being asked to join a room. For those of you who are with us in the main room, if you can check your screen, we have asked you to join your community circle during this time and engage in a conversation around movement for this data. Yes, let me. For those of you here in the main room, can you hear me? Can you give me a sign, a thumbs up, some chat, unmute, if it's possible? Hi, Sophia.
I was in a Spanish room, so I came back.
Oh, I'm sorry.
I was clicking the help button, but it was just saying my host was in the room.
Oh, I'm sorry about that. Let me get you over to a different one. There you go.
Is Aurora English? Yeah.
Aurora is in Spanish.
Okay, it wants me to join a Spanish one again.
Uh-oh.
So I pressed not now. Sorry.
Okay, no worries. Let me find you right here. All right, looks like we got you going with Allison.
Okay, I'm waiting for it to pop up with Allison because it popped up with Aurora again.
Let's try to get you with Andrea. Hope, Sandra, Brent, Nancy, Mr. Ahmed, Michelle, Tanya, Susan, Kelly, Abigail, Michelle. If you can hear us, we are in our portion of our community circles, and we'd love it if you can return to your computers, your phones, and join us in those smaller community circle breakout rooms. All right, Peter, it looks like these guys are away from their desk, away from their phones, and are unable to hear me. I'm gonna offer support in Ms. Diane's community circle, but if you need anything, just give me a chat.
Okay, could you help me test something real quick? I just want to make sure my messages go to all breakout rooms.
Sure, do I need to be in the breakout room to help test?
Yes, I'm gonna send a message and come back and let me know if you see it.
Okay, I will text you and I will admit myself into room number 2.
Okay.
Here you go. Hello? Peter? Is anybody in the main room?
Hi, who's speaking right now?
This is Quadria. I was calling because I was, trying to talk because I have to actually leave. Will I be able to do a survey? Because I know y'all said the breakout rooms is for like 30 minutes.
Oh, yes, 1 second. Let me just confirm.
What time is it actually over? 3:30?
Yes, 3:30, yes.
Because I have a meeting right now at 3:10.
Okay, yes, we'd be happy to, we should be able to send you the survey manually. Just feel free to reach out to the info@nachw.org email and request that, and we'll set you
Okay,
up.
because I seen some things in the breakout rooms. I had put sticky notes and everything. I followed through with it. Okay, so can you just please make sure that I'm gonna put my things in the chat so it can be sent to me?
Absolutely, please do.
You have to go upstairs, right?
Mhm.
What's up?
I'm trying to see where I can put it at. Oh, I see a chat. Okay, I'm gonna put my email in the chat.
Great, I see it.
Thank you.
Thank you very much. Have a good day.
You too.
Just checking in to see if anyone came back. If any of you are currently unassigned to a breakout group and you would like to be assigned to one, just let me know and I'll send you to one.
I want to apologize for our technical difficulties and thank you guys for bearing with us as we sorted through 200 people into breakout rooms. That just shows how amazing our tech team is. And we hope that you found meaningful discussion, community engagement, and togetherness in these community circles and answering some of the questions from the data. I was able to hop in and out of some of these breakout rooms, and I heard your feedback about not being able to visualize the data in front of us. So we'll make sure that we have clips of some of our data sets in the next breakout room so that you guys can have a nice refresher as you're answering these questions. So I've heard you, and I will make sure to make note of all of that. I think we still have a few folks coming in. Thank you, Auntie Jessie. Let's see if we've got any more folks in our breakout rooms. If we could get our tech team to close all rooms.
I don't know where my auntie is, but I want to give a shout out to Auntie Jessie. I want to thank Auntie Jessie for her leadership and for her love. I want to thank her for all the work she's doing at CHW. I want to thank her for her team, for introducing me to Kathy and so many others. It was a pleasure to visit the islands and to be with a community of CHW women. They turned out and they're building a coalition from the ground. It's powerful work. It's awesome work. And I just applaud them. It's difficult work. You know, we all need allies. We've talked about that, but just wonderful to be in this company of each of you.
Ditto to you, Denise, without your help.
Oh, there you are.
We'll give you a big hug and thank you so much as we
God
move
bless you,
forward.
Auntie.
And you're putting us in touch with people like Michaela and some of the others that I met and such. They're all going to help CHW, not just CHW, but the state of Hawaii. Thank you so much.
Thank you. Thank you for all that you're doing there. Tireless work, you know. Some people have been doing this work for decades, you know. Michaela, please don't let me get started. But I'm just saying, there's billions of dollars that are coming into your states right now. Okay. And I know we're all at many different organizations and we are very used to fighting one another for scraps, right? For little grants and this type of thing. It is time for us to be organized at the level of the state and at the national level with CHWs across geographies, across ethnicity, across different sectors and lived experience, those from reentry, those who are peers, those serving youth who are homeless, those who are dealing with diabetes, and all CHWs coming together to say, this is where the dollars need to flow into our community organizations, into what works, what we know works to preserve health and wellness and to strengthen our communities. So I hope this data, I hope you can take it back and it is an organizing tool for you, right? What kind of data do we need in our state? This is what NACHW is collecting, but what do we want to focus on, right? Can NACHW share other data with us? How are we going to use it? Can they help us organize or structure or facilitate a meeting? You all are already doing incredible work, so we just want to see you shine.
Absolutely, Denise. As we leave each other today, I want to extend my gratitude to each and every one of you who has joined us today. I am a face of CHW inequity and injustice. I have felt the effects of these inequities in my own personal experience, in my own state, and my journey of becoming a CHW, a certified CHW. We hope that you leave here feeling empowered and informed on the CHW professional identity and will make strides in action and improvement. We also hope to see you back on September 29th for our second installment of these data findings in action presented by our amazing Johnson & Johnson leaders. We have a special gift for you to take with you today. Please download your copy of our infographics and share it far and wide. You are all in my thoughts and prayers. Please stay safe. Grab those infographics on your way out. You'll be able to download them, keep them, share them, use them as tools, use them as advocacy tools. These are your pieces of strength. These solidify all of your emotions, all of your feelings, every experience that you know to be true. Thanks, Amber. See you tomorrow. Bye, Paige. I know you're in here. You're just awfully quiet today.